I struggled with my weight for as long as I can remember. I've tried every diet imaginable, and I love to exercise, but every time I would lose the weight, I would always gain it right back and then weigh even more. And I was so tired of fighting my whole life and never winning. I just felt defeated, and I felt like there was no hope really for a different life. I had a girlfriend who had success with bariatric surgery, and she looked amazing, and she felt amazing, and she was happy, and she had great success, and success I had never seen and I didn't know could be possible for me. Henry Ford Bariatric Surgery team explained to me that it would be a tool and not just a gift. It was something I was going to have to work really hard for. But I felt confident after meeting with them that it was something that would finally work for me. Since my surgery, I've been able to maintain a 90-pound weight loss, and I feel strong and brave for taking a chance on myself to make a better, healthier life for myself. I have so much energy. I have more energy than I ever knew was possible. I'll tell my son that I'm gonna run into the store, and sometimes I literally run into the store. It's so much fun. I really just feel like I'm living such a full life now.
Henry Ford Bariatric Surgery was here for Lindsay, and we're here for you. Henry Ford Bariatric Surgery is available at 5 locations. Our dedicated bariatric surgeons are committed to quality and safety. Our experienced team includes surgeons, nurses, dietitians, exercise specialists, behavioral health specialists, and other medical professionals who are here to support you from your first appointment through your surgery, recovery, and follow-up care.
Our patients are the reason for everything we do. As the Henry Ford Health System Medical Director for Bariatric Surgery and Weight Management, I see the tremendous impact this surgery has on our patients' health and quality of life. We are rewarded by the physical and emotional transformation we witness every day. Successful bariatric or weight loss surgery is a partnership. It requires a serious commitment on the part of the patient to make permanent changes to the way they eat and their level of activity. Together, this leads to significant positive lifestyle changes. Bariatric surgery also requires the commitment of a medical team that has the skill and ability to perform surgery safely, is accessible to their patients, and listens to and cares about their patients' goals and concerns. As a team, we are deeply committed to providing the education and support you need for long-term success. If you are willing to live healthier, we are here to help you every step of the way. This video will explain the main types of bariatric surgery, along with their risks and benefits. It will also highlight the main steps in the process: intake, education, pre-surgery, surgery, and post-surgery, and what you can expect at each step. Our goal is to help you make an informed decision about what is best for you. If it turns out bariatric surgery is not the right choice for you, we are happy to discuss available options for non-surgical weight loss.
Bariatric or weight loss surgery makes changes to your digestive system by limiting the amount of food you can eat, reducing your absorption of nutrients, and altering your body's energy balance. Henry Ford Health System currently offers 2 types of bariatric surgery, which have been proven to be safe and effective. These are sleeve gastrectomy and gastric bypass. This video will go over the specifics of both operations, and while each has its strong benefits, as with any major surgery, there are possible short-term and long-term complications. Now, bariatric surgery is not a cosmetic procedure, nor is it a quick or easy solution to improve your appearance. Instead, think of bariatric surgery as a tool, or as one point in the triangle of success for weight loss, with the other 2 points being healthy eating and regular intentional exercise. When combined with these 2 critical lifestyle changes, bariatric surgery is the most effective treatment available for long-term weight management. Remember, all 3 elements are important. You can't just pick and choose how you're going to get healthy. This is an all-in lifestyle change. Now, weight loss surgery isn't for everyone. At a minimum, requirements for bariatric surgery include the following: a body mass index of 40 or greater, a body mass index of 35 to 39 with severe weight-related health issues, including things like type 2 diabetes, high blood pressure, severe sleep apnea, severe joint pain, or mobility issues. With the right patient, the right commitment, and the right medical team, bariatric surgery can have incredible outcomes. One of my patients, for example, a 50-year-old gentleman, was on 70 prescription medication pills. He He was also taking insulin for diabetes. And 1 year after bariatric surgery, he no longer needed any medications, he was off insulin, and he was running marathons. Now, not every patient can experience such dramatic results, but many will see significant improvements and reversal of their chronic health conditions, including things such as arthritis and mobility issues, asthma, depression and anxiety, diabetes, gastroesophageal reflux disease, high blood pressure, high cholesterol, sleep apnea, infertility issues, and urinary incontinence. Some patients choose to have bariatric surgery prior to a total hip or knee replacement, and this is to improve their outcomes and reduce their discomfort and duration of recovery. As with any major surgery, bariatric surgery has possible risks and side effects. Clinical evidence shows that the risk of complications related to obesity is greater than the risk of undergoing bariatric surgery. Some of the possible risks of surgery include things like bleeding, blood clots, infection, lung problems, bowel obstruction, gallstones, hernias, heart attack, stroke, or ulcers. But fortunately, bariatric surgery is generally very safe. And here are the facts. The risk of death is 1 in 1,000, which makes it safer than having your gallbladder removed. The likelihood of a major complication, less than 5%. Patients who undergo bariatric surgery can lower their risk of 5-year mortality by nearly 90%. And several studies demonstrate that the risk for premature death is reduced by 30 to 40%. Weight loss surgery can even lower your risk of certain cancers, like breast, prostate, and uterine. And finally, bariatric surgery can extend your life by up to 15 years.
For most of our patients, bariatric surgery can be performed minimally invasively with the use of robotics or laparoscopy. In the small percentage of patients, due to unforeseen complications or pre-existing conditions, every one of our surgeons is skilled and trained to perform traditional open surgery. We always do what we think is safest for our patients. Not only do we perform bariatric surgery skillfully and safely, but every member of the Henry Ford Bariatric Surgery and Weight Management team also has the compassion and desire to make your experience with us a very positive one. We respect the difficult decision that you've made to change your lifestyle and live a healthier life. We know it takes a great deal of humility to seek out weight loss surgery, and we don't ever want you to feel judged as you go through this process with us. My own experience with weight-related health issues and surgical training was the driving force for me to specialize in bariatric surgery. I wholeheartedly believe that bariatric surgery improves the quality of my patients' lives. We've seen the behaviors that lead to long-term weight loss success and failures, and we all want you to succeed. The changes in your lifestyle in terms of diet and exercise are necessary for you to have the best possible experience, recovery, and results from surgery.
The education and support and encouragement I received from the Henry Ford Health team really helped give me the confidence I've needed to maintain my weight loss and continue to make healthy choices and be active. I'm finally able to fully participate in my life with my husband and my son, and I really feel like I am finally living my best life.
The first step in the bariatric surgery process is intake. At this time, you will meet your intake coordinator. We understand that this process includes a lot of preparation and follow-up, which can seem confusing, even overwhelming at first. We are here to make it easier for you with personal support to guide you through every step of the way. The intake process includes confirming you meet the physical requirements for weight loss surgery, including weight and BMI, insurance verification and paperwork, review of medical, surgical, and weight loss history, setting up consultations with a dietitian, exercise specialist, and behavioral health specialist. For the best surgical experience, recovery, and results, we will require you to make preparations that will likely include restrictions on eating and drinking and stopping certain medications. We will explain more about this shortly.
What and how you eat following bariatric surgery will have a major impact on your long-term weight loss success. Because of the changes the surgery will make to your digestion and ability to absorb nutrients, learning about and following healthy eating habits are very important. You will have access to a registered dietitian throughout your entire weight loss journey. We will help you alter your food plan before and after your surgery to maximize your success. We will also help you determine which dietary supplements you may need to ensure you are getting enough nutrients. And we will provide you understanding and support as you get used to a new, healthier way of eating. You can actually start making dietary changes now. Focus on nutrient-rich foods like lean protein, vegetables, whole grains, and low-fat dairy. Increase intake of water while reducing sugar-sweetened beverages. Try adding lemon, lime, or other fruit to enhance the flavor. And create a healthier meal by making your plate half vegetables, a quarter protein, and a quarter whole grain.
Planned exercise and physical activity are essential for long-term weight loss success and good health. Our Henry Ford exercise team is focused on working with individuals who are more than 100 pounds overweight. And we know how to safely increase your level of activity as you build strength and stamina. Every bariatric surgery patient will meet at least once with an exercise physiologist like myself. Depending on your individual needs, you may see us more often. We will help you to plan a structured exercise program that includes aerobic and endurance exercises like walking, biking, swimming, or chair aerobics, strength and resistance exercises such as free weights, weight machines, and wall push-ups, as well as flexibility exercises including stretching, yoga, or Tai Chi. Regular exercise will become a part of your life. Following an exercise plan will help to keep you motivated and on track.
The pre-surgery process begins with an interview between you and a psychologist. The purpose of this interview is to make sure you understand all aspects of bariatric surgery and are emotionally as well as physically ready to go forward. It will not only help you decide if bariatric surgery is the right choice for you at the right time, but it will help your medical team determine whether you're a good candidate for long-term bariatric surgery success. In your best interest, we need to make sure that you are well informed about the surgical process, benefits, and risks, have realistic expectations for what the surgery can and cannot do, understand how your life may change after surgery, including side effects, are able to deal with setbacks, and are committed to lifelong changes that include healthy eating, intentional physical activity, taking vitamins and minerals, and having medical follow-ups.
The psychological interview was intimidating at first, but I knew immediately that the team really cared about me and my success, and it gave me the confidence I needed to make the choice to do it because I knew that they knew that I had all of the tools I needed for success and that they cared about my success, and it felt like they were on my team and I was ready to succeed and make the changes I needed to in my lifestyle.
There are several different types of weight loss surgery. Based on research, experience, patient safety, and proven long-term successful outcomes, Henry Ford Health System offer two surgical options: the laparoscopic Roux-en-Y gastric bypass and the laparoscopic sleeve gastrectomy. We also offer an innovative incisionless procedure called endoscopic sleeve gastroplasty. Your Henry Ford team will help you decide which is your best option. So the first type of surgery we will discuss is the laparoscopic Roux-en-Y gastric bypass. This is considered the gold standard of weight loss surgery because it's been in use the longest. It is a minimally invasive surgery done with laparoscopic small incisions. It creates a small 1-ounce pouch out of your stomach. It also bypasses a part of your small intestine. With this surgery, there's potential for side effects including dumping syndrome, which can happen when undigested foods, especially sweets, move too quickly from the stomach to the lower intestines. This can cause abdominal cramps, nausea, sweating, diarrhea within an hour or two after eating. Dumping syndrome can be managed or prevented through dietary modifications. The advantages of the surgery include improving or resolving many health-related problems like diabetes, blood pressure, sleep apnea. There are no implants, less risk of acid reflux, and also changes in metabolism. The disadvantages: potential malabsorption of vitamins, risk of dumping syndrome, a high risk of complications with smoking and alcohol use. The second procedure we do is the laparoscopic sleeve gastrectomy. It is also minimally invasive, which means it's done also with few small incisions, and it removes 80% of the stomach. This procedure does not involve bypassing your intestines. Advantages: improving or resolving many health-related problems like diabetes, high blood pressure, and sleep apnea. There are no implants and lower risk of dumping syndrome and malabsorption. The disadvantages: potential leak, and these are harder to treat. It is non-reversible, and there's 30 to 50% risk of acid reflux that may require follow-up endoscopies and procedures. The last procedure we're going to discuss is the endoscopic sleeve gastroplasty. Henry Ford Health System is one of the few in Michigan to offer this innovative type of weight loss procedure. Without making incisions, the physician reduces the size of your stomach using a suturing device placed through your mouth. The advantages of this procedure: it's incisionless, minimally invasive. It is potentially reversible. The disadvantages: half the effectiveness of other weight loss surgeries. Not appropriate for everyone and cannot be done if someone has a larger hiatal hernia or previous stomach surgery. It's currently not covered by health insurance, and the long-term effectiveness and risks are not well known yet.
As with most major surgeries, you can expect some discomfort immediately after. We will keep you comfortable and help you manage any pain. Within a few days, over-the-counter medications such as Tylenol will likely be all you need. Your nurse will get you up and walking the day of surgery to reduce the risk of serious complications like blood clots or pneumonia. This may be uncomfortable, but the sooner you get up, the sooner you will recover. Once you are at home, you can start with 10-minute walks several times a day and gradually progress to increase your speed and distance. Depending on the type of work you do, you should be able to return to your job 2 to 4 weeks after surgery. Be sure to discuss this with your surgeon and employer before surgery. Certain lifestyle habits such as smoking, vaping, drinking alcohol, and using marijuana or illegal recreational drugs can have a negative impact on your weight loss success and overall health. Your Henry Ford team will be happy to talk more with you about what to avoid after bariatric surgery, as well as ways to improve your long-term results.
After your life-changing bariatric surgery, your new healthier life truly begins. You will begin eating differently, nourishing your body with foods that supply the energy you need to increase your daily activity. You will continue to have access to your dietitian, and you will see your healthcare team regularly for checkups and support. Your commitment and determination will make the difference in the amount of weight you lose and your long-term success. On behalf of the entire Henry Ford Bariatric Surgery team, I thank you for watching this video.
To speak with an expert and discuss your options for a personalized weight loss track, please call us at 866-326-6790.